just about to start my final year of medicine at the University of Oxford. I study at Exeter College, and today we're going to talk through the UCAT. So that's one of the admissions exams that's used at UK medical schools for medicine. Whilst Oxford used to use the BMAT, I have sat the UCAT myself. I sat the UCAT and applied to two UCAT universities and two BMAT. I got the offer for both of the UCAT universities I applied to, despite it not being a requirement for Oxford. I've also tutored the UCAT for coming up close to 4 years. It is a very difficult exam. I still tell students to this day it's one of the hardest exams that I've ever sat, and I've done 5 years of exams at Oxford. So it is a very difficult exam. And it's quite different to what a lot of students would have ever sat before, because it's not based off of knowledge you may have learnt during GCSEs or equivalent or A levels. It's an aptitude test. So it's based around your critical thinking and like basic math skills. So the UCAT is a 2-hour exam, and you often sit at a test centre, and it has 5 sections. The sections are verbal reasoning, abstract reasoning, quantitative reasoning, decision making, and situational judgment. And verbal reasoning involves you getting given a passage of text, and you roughly have 2 minutes to answer 4 questions about that piece of text. And the questions range from either being true, false, or can't tell. So you have a statement which might say the First World War was from 1914 to 1918. Was this true, false, or you can't tell? And then you'd search through the passage to find an answer. Or the question might be a single best answer, and it might say, which of the following statements does the author most likely agree with? And then you would read through the 4 answer options and then choose the answer you think the author most likely agrees with. So that's the basis of verbal reasoning. And the importance of verbal reasoning for medicine is we are presented with lots of data about patients on a day-to-day basis. We often do a variety of tests, from blood tests to scans. There's often a lot of diseases nowadays are multifactorial. Patients, we have an aging population in the UK. A lot of our patients are 70 onwards. They have a lot of health history and a lot in their medical records. And we have a limited time as clinicians to be able to go through the records and pick out what's relevant and what isn't. And that's the importance of this verbal reasoning section. There's unfortunately a lot of sort of fake news nowadays around medicine, and this was particularly shown during the COVID-19 pandemic and a lot of the information regarding vaccines. So it's really important for those who do want to go into the medical field to be able to critically analyse the data that we're presented with, and work out whether it's true or not, so we can do the best by our patients. And then abstract reasoning. Abstract reasoning has 4 different question types, and I'll talk through that in a minute, and we'll go through some examples. But the premise of abstract reasoning is to be able to spot patterns very quickly. So you're often given 2 sets, so set A and set B, and each set is made up of 6 boxes. And you have to try and find what is the pattern of set A and what's the pattern of set B. And then you're given test shapes, and you're often given 4 test shapes, and you have to say whether that shape belongs to either set A or set B. But we'll go through an example in a minute. And then there's decision making. Decision making has 6 different question types within it, ranging from Venn diagrams, ranging from questions regarding probability. And then there's quantitative reasoning, which, as the name suggests, is quite math-based. Again, it doesn't ever go beyond GCSE level. So if your son or daughter isn't doing maths at A level or A level equivalent, that shouldn't be a problem at all. It shouldn't disadvantage them. It's based on basic mental maths, and that's really important in the medical profession. We often have to dose drugs dependent on patients' weight, and that's something that ideally we should be able to do quite quickly. And I'm sure you can understand that getting the correct dosage given to patients is incredibly important and can be a matter of life or death. So that's one way that the UCAT helps assess this. And then lastly, we have situational judgment. And situational judgment is there to test sort of the 4 main pillars of medicine, including like beneficence, justice, autonomy, and it's usually a passage regarding a situation. For example, you may be a medical student and you might see one of the consultants on the ward drinking alcohol near his locker. And how do you approach that situation? And obviously that's very daunting. There is quite a hierarchical aspect to medicine. The consultant is seen as being higher than you as a medical student. But in all areas of medicine, the patient has to come first. And practicing under the influence is illegal, goes against the General Medical Council guidelines. So we have to do something about it. And you're often given 4 options, and you rank which option you think is the most appropriate. And it will be very appropriate, appropriate, inappropriate, or very inappropriate. So for example, if it said, ignore that you've seen the doctor drinking alcohol and carry on with your day, that would be a very inappropriate thing to do, because that would be putting patients' lives at risk. So I'm just going to share my screen. So if you just give me a second, and it'll let me know when you can see it. It still says it's loading. So hopefully you can see my screen now. So as mentioned, we're going to briefly talk through the abstract reasoning in more detail. Unfortunately, like all areas of the UCAT, it is very time pressured. You only have 12 minutes to answer 50 questions. And that's why with all of UCAT, the technique is really important, and it's practice that makes perfect. And that's been reflected in people's results. Those who have spent the time practicing, doing questions so that they can spot the pattern are those people who do get higher marks in the exam. So as I said before, there are 4 types of questions in abstract reasoning. The first and the most common is type 1. And this is where you're given 2 sets of shapes, which are labeled set A and set B. For example, if I just scroll down, this should say set B, so my apologies, but this would be an example of set A, where you have 6 lots of boxes and 6 lots of shapes, and this would be set B. And what they're wanting you to do in that question is you want to identify the pattern that they're following for set A and set B. So when you get given the test shape, for example, these are your test shapes here, 1 through to 5, and you have to decide, does this shape belong to set A, or does it belong to set B, or does it belong to none of them? So they're the most common question type that we have in abstract reasoning. But there's also type 2, where you're given 4 shapes, and I'll scroll down to give you an example, like here. You're given 4 shapes, and something has happened to this shape to make it this shape, and something's happened to this shape to make it this shape, and then this shape to make it this shape. And you're wanting to find the next shape in the series. So you would start with this box and think, what's changed between this one and this one? And I always teach my students to break it down. So there's 2 things that's going on in these boxes. The first one is the position of this straight line. The second one is the circle. So if we focus on the circle to begin with, we go from white to black to white to black. So hopefully you'll be able to think, I think the next shape is going to be a white shape. So we get rid of our answer options C and D. And then we want to focus on the next aspect of the box, which is the straight line. And it goes from the straight line at the side to the corner to the side to the corner. So that makes me think the next is going to be to the side. So therefore our answer option would be B. And whilst that seems very simplistic, what's really important with UCAT is following the rule time and time again, because you'll get to certain questions that are very difficult. But if you follow the same order of how you do things, so you're going to break the question down, you stick with one component to begin with, for example, white, black, and then you get rid of the answers. So even if we couldn't work out the second bit of this rule, we didn't know what was going on with the line, we've taken the chance of getting a correct answer from 1 in 4 to 1 in 2. That's a significant increase in the probability you're going to get that. And then the example of a type 3 question is they'll have two boxes, and they'll say this first box is to this, as this is to this. And what you need to do is work out what has happened to this first box to make it into this, and apply that same rule to this shape down here. So I teach my students to state the obvious. So I would say, in the first box, we can see we have a triangle on the outside. A triangle has 3 sides, and in the middle, we have a square. And then if we move to the second box, and a square has 4 sides. If we move to the second box, on the outside, we have a diamond. A diamond has 4 sides, and on the middle, in the middle, we have a triangle, and a triangle has 3 sides. So just by stating the obvious, we can start to think, okay, so the outside shape has gone from 3 to 4, and the middle has gone from 4 to 3. So if we're applying that same rule for the box down here, we want to add 1 side to the outer shape. So we want to go from 2 sides to 3 sides, and we want to take away 1 side from the middle. So we want to have 3 on the outside and 3 on the inside, and that would be our answer option. And then the last of the 4 is very, very similar to type 1. So again, you're presented with set A and set B, each of which have 6 boxes. And the response, and instead of being given 5 test shapes like we were, here we had 5 test shapes, you're only given 1. So that is pretty much identical to type 1. So they're the 4 types of questions that you have in abstract reasoning. And the last thing that I want to go through is the approach that I teach students to use in abstract reasoning questions. And there's lots out there online. I like to use SSSPN. That's what I use when I sat my UCAT exam. You might see something called scans online. That's the exact same thing, just in a different order. You use what works best for you. But if a student is struggling with abstract reasoning or hasn't come across it before, then I teach SSSPN. And this is a mnemonic that stands for shape, size, shade, position, and number. So when a student is presented with set A and set B, the first thing I say to them is the things you can rule out really, really quickly is size and position. So if the pattern is size, it's really, really obvious. There's obviously a small shape and a big shape in every box. And that's not the case here. It's not standing out to me. These circles are relatively similar in size. So I would say to the student, cross off size straight away. It's not size. And then the next thing I would say is we can rule out position. Again, position is really obvious. And in future lessons, we can look at examples of a position pattern, and it'll really hammer home that position is very obvious. It's usually there's a circle in the top left-hand corner of every box, or in the top right-hand corner of every box. But here there's no obvious position. The circles are relatively central. So I would say, and again, time is really key here. So we need to be really speedy. We go with our gut, we get rid of size, and we get rid of position. So now we're left with shape, shade, and number. So how I teach my students to approach it is we pick the simplest box. And for me, that would be this box here. It's one circle that has no shading. So I would then get my student to state the obvious. Here we have a circle. And what are the properties of a circle? Well, there aren't many. It has one side. The sides are all curved. And it has a line of symmetry. So then I want to compare what we have in this box to the box next to it. And we want to see what they have in common. So the obvious commonality here is there are circles. It's not going to be number because we have 1 circle in this box and 3 in this box. And also, if you look underneath, there's 2 circles in this box. So it's not that there's only odd number of shapes, which you might have thought there's 1 shape here, 3 there, but there's 2 down below. So I don't think this is to do with number. So we get the student to get rid of number. So we're left with shade and we're left with shape. Now, the rule has to apply to every single box. There's no shading here and there's no shading here. However, there's shading in one of the boxes in the set. So this rule can't be to do with shading because the rule has to apply to all of the boxes. So we get rid of shading and therefore we're left with shape. So the rule of this set is that every box in the set so I'm just blocking out the sun. Every box in the set has to have at least one circle in. So that is our rule for this. So the takeaway from this is that UCAT is a very difficult exam. And I like to tell my students, it's kind of like learning to tell the time. It's one of those things where you can practice and practice and practice, and then all of a sudden it will click, and you'll see that your results will they'll go up slightly, and then all of a sudden they'll go really steeply. And it's practice that makes perfect. And it's really important to learn a technique and stick to the technique, because it's been shown in lots of literature that people who stick to the same technique are those that get the higher results. And at the end of the day, it's the good admission exam results that UK universities are looking to decide which students they want to interview. But I'll stop sharing my screen there. And if you do have any questions, I'm more than happy to answer them. I'm sure that you can reach out to me through my email, and I'm happy to talk through the other sections of the UCAT.